Hi, I'm Lakresha, Claims Adjuster and Risk Manager here at AlaCOMP. Today I'm joined with Tony Bridges and John Concetti of Therapy South, and I'll just let you two go into your roles here at Therapy South.
Okay, my name's Tony Bridges, and I'm the Director of Industrial Rehab for Therapy South, and that's what I do: FCEs, work hardening, job test, impairment ratings.
And I'm John Concetti. I'm a LPTA with Therapy South. I'm also a work comp specialist, and I assist Tony with some of his work conditioning, FCEs, and I do all of the physical therapy for our workman's comp patients.
Great. Today we will be going over FCEs, which is functional capacity evaluations, the polylift system, and proper ergonomics in the workplace. Guys, could you explain what an FCE is and why it's important in the workers' compensation process?
Okay, so an FCE is a test to determine if a patient is ready to return to work or not. And really, that's the bottom line. It's going to test their overall function, and the physicians are going to use it. Of course, the insurance companies are going to use it, but it's to give that clearer picture of where this patient's at.
Okay, awesome. How does an FCE help determine if the injured worker is ready to return back to work safely?
Well, because it's going to go over all the physical characteristics of work. It's going to determine their physical demand level, which is how much weight they can lift, push, pull, carry. It's going to address, like I say, all the physical characteristics, how much they can bend, squat, kneel, climb, and those type of things. And those are the things that the doctor needs to know in terms of returning them back to work.
Absolutely, absolutely. What specific tests are included in the FCE, and how does it relate to their job duties?
So there's a battery of tests that are done, and kind of depending on the diagnosis, that's where the test will veer off, as well as the specific job duties. But there's a battery of testing that everybody's going to do, and it's going to cover everything from floor to overhead and everything in between. And it's going to cover the basic essential functions, such as bending, squatting, kneeling. Then the test may veer off. For example, if it was an ankle injury, we may do a series of ankle-related tests. If it was a truck driver, we would definitely do like a climbing test to see how high they can climb to get in a truck, if they're able to do that. So while there is similarities with all the tests, the test will take a veer depending on the diagnosis and the job demands.
Okay, perfect. So once this FCE, functional capacity evaluation, is complete, does the employer get a copy of this? The insurance company, do they get a copy of this? What should they expect?
So we'll send a copy to the doctor and to the insurance company and the case manager, and the employer, of course, will get it from you guys.
Okay, so what should the employer look for when they're reviewing that FC report, when they receive it back in their hand? What should they look for on that functional capacity evaluation form when they return back in hand with that to their employer?
Yeah, that report, can be a nightmare for people. So, if you get that report back and you're looking at something very thick with a lot of pages,
Absolutely.
That's not what you want. It's going to be a lot of garbage in there, frankly. You want to be more concise and to the point. Like with our FCE, it's about 4 pages long, 4 or 5 pages, and really you can get to the meat of it really quick because we have a PBI rating. So what should an employer look for? You want to look for the bottom line of what was achieved on the FCE. Did they give good effort or did they not give good effort? And this is a big one. A test has to close out with some recommendations. I mean, you have to make a call of this person's ready to go back to work, they're not ready to go back to work, or whatever the situation may be. But you got to get to a conclusion and a recommendation. So, like I say, a lot of garbage and a lot of tests, and a lot of tests are around. And you just got to choose, and you always hear this word, you want the one that's going to be the most objective. And so how do you determine that? We'll talk about that a little later.
Perfect, perfect. Thank thank you. Those are some great insights on the functional capacity evaluation.